Hello everyone. My name is Aparna Kamulkar. I am a practicing pelvic floor physical therapist in central New Jersey. I have put together a short series of informational videos and posts based on information that I would like to share about vaginismus. I know that you all are in this group because vaginismus has touched your life or somebody that's close to you in some way or the other. So hopefully you will find these posts useful. Just before we start with the informational video for today, I would like to present a disclaimer. I just want you guys to know that I am a physical therapist practicing in New Jersey, but these videos and posts that I will be sharing on this group are just purely general information that I would like to share with you. Please do not treat this as any kind of medical or therapeutic advice. Please follow any suggestions, exercises, any activities that I recommend at your own discretion, and make sure that if you have any new symptoms or if you have any furthering concerns, make sure you reach out to your medical professional, either your gynecologist or your pelvic floor physical therapist. Even though I am a licensed physical therapist, I do not offer any kind of medical advice to anyone without completely and fully assessing and evaluating patients. And I hope you guys understand that. Okay, so let's start with our first video. Today's topic that I have picked is basically anatomy and pathophysiology of vaginismus. So let's start with what is the definition of vaginismus. Vaginismus, to explain in very lay terms, is basically a psychosocial condition in which the muscles around the vagina involuntarily contract or spasm or tighten in response to the fear of penetration. So basically, in this condition, the person that has vaginismus, their body kind of responds to the fear of pain from any kind of penetration. The penetration could be as small as using a tampon or getting some kind of a gynecological exam, or it could be sexual penetration. Now, vaginismus is of two types. The primary one is the one in which the person has never been able to experience or tolerate penetration. Right from the time they were young and they were exposed to any kind of penetration, they've responded with fear and sometimes pain and the whole progression. Secondary vaginismus is when a person was able to tolerate penetration before but has developed vaginismus in response to some kind of an incident in their life. This incident could be some kind of sexual abuse, or it could be a scary incident such as a fall from a, a height or injury to the vaginal area. It could also be um, a difficult labor, episiotomy, scarring in that area, and sometimes people can develop vaginismus even without a known incident. But when it develops after a period of a person being able to tolerate penetration before, then it's called secondary vaginismus. Let's start with the anatomy now. So I am going to share with you guys, I'm going to show you guys a model of a female pelvis, and that'll make it much easier for you guys to understand. So this is the model that I'm going to use. This is the model of a female pelvis. This is the front part of it, and this is the back because you can see the spine right here. Now, this bone right here is the pubic bone. So it's the bony prominence right above your vagina. Okay. These right here are your hip bones. So I'm going to stand up and just show you the bony prominence that you feel on both sides right around here, around your pant line, is the ASIS, or these bones right here. These bones right here, okay? These bones. Now I'm going to turn this around so you can see the back. This is the spine, and where it ends right here is the coccyx, or your tailbone, okay? And these right here are the sit bones. So the bony prominence that you feel when you sit down, it's underneath your buttocks, okay? Now I'm going to turn this model around, and I am going to show you what pelvic floor muscles are, because we will be talking a lot about the same. Pelvic floor muscles are a group of muscles that almost form like a muscular underwear in this pelvic region. So everything that you see in red out here is showing you the muscles, okay? What's in blue is the ligaments. They're a very important part of the entire pelvic area, but today we are going to talk more about the pelvic floor. Now, these pelvic floor muscles are in 3 layers, okay? What you see right here is the most superficial layer, okay? And just to give you an estimate, if I insert my finger in this model, this is the vaginal opening, and if I insert a finger, then from the superficial layer will extend from the tip of my finger to my first knuckle. That's the depth of the superficial muscles, okay? The middle layer extends from the tip of the finger to my second knuckle, so I would have to insert almost this much length in order to feel or palpate the second layer. And then the deepest layer of the pelvic floor muscles is, of course, insertion of almost beyond my second knuckle, which you can see from here, from the inside. They form the inner lining of the pelvic bowl, okay? So now that we saw a little bit and understood a little bit about the pelvic floor muscles, I'm going to show you the vaginal area. I'm also going to display a picture right up here, but what you see in the picture is what I'm going to explain on the model, okay? So basically, this opening right here that you can see is the vaginal opening, okay? This here around it is the labia, or the lips. You don't really need to know the details, but the outer portion is the labia majora, the inner portion is the labia minora. All the names that I'm taking, really, you guys don't need to try to remember the names or anything like that. It's just more of the general anatomy that I would like you to understand, so that, because then that becomes relevant when we talk about the treatment, which I will be talking about in the future sessions, okay? So again, coming back to this is the vaginal opening. This here is the labia. This little tiny opening right here is the urethral opening. That's where the pee comes out from. This is the anus, where the poop comes out. This is the perineal body. This right here is the clitoris, okay? So the most important thing now here in this model and in the anatomy is this red muscle that surrounds the vaginal area. They've taken it out from here so you could see the deeper structures, but here, you can see it here. It's on both sides. It's like a bulb. It's called the bulbocavernosus muscle. And this is the ischiocavernosus muscle, which is like almost like a cave. So the bulbocavernosus muscle is the muscle that surrounds the vagina like a bulb, and the ischiocavernosus muscle is a muscle that surrounds that's close to the vagina, almost like a cave. These two are two major muscles in the most superficial layer of the pelvic floor muscles. And these are the muscles that are the ones that create havoc in vaginismus. These are the muscles that really contract involuntarily and go into a spasm in a person that has vaginismus in response to pain or mm, pain of pain from penetration. Okay, so that now is just a little anatomy. The next part that I'm going to cover is the pathophysiology. It's just a big word for how or what happens in vaginismus. Why does it really happen? Why does vaginismus happen? So when we talk about that, I want you guys to again remember that vaginismus is a psychosexual condition. So talking about the pathophysiology of vaginismus, I would like to remind you all that vaginismus is a psychosexual condition. So that means that it has a psychological component and the sexual component or the sexual physical component. What I explained to you here about how these muscles, how I explained to you guys about how the muscles go into, like what muscles exactly go into spasm, causing it very difficult for a person to tolerate penetration. We want to understand now why that happens in vaginismus, okay? And that's why we are going to understand the psychological part, or actually the physiology part of it, by taking a look at the diagram that I am going to show you here, which is called the cycle of pain. So basically, it all starts with an anticipation of pain. Okay, a person that has this condition anticipates pain, associates, their brain associates penetration with pain. So because of that association that they first make in their brain or mind, anytime penetration is attempted, and again, it could be any kind of penetration, it could be tampons or OBGYN exam or sexual penetration, any kind of penetration, what happens is the muscles around the vagina of this person tighten up. Okay, now that's their response to the anticipation of pain. But what happens is when the muscles tighten up and they continue to try or they continue to attempt the penetration or are forced into penetration for some reason or the other, what happens is that attempt of penetration through a really tightened perivaginal muscles causes pain. And when that happens, the brain associates it even more with pain. So now, first it was only anticipation, but now at this stage, what happens is the pain actually occurs because of the tightening of the muscles, and now the brain, now it's sealed in the minds or the brain that definitely, okay, penetration is painful and that's what is happening, and the muscles around the vagina and in the body tighten up even more. Okay, and then this kind of becomes a cycle, a vicious cycle, to such an extent that at a certain level, these muscles and even generalized muscles in the body just contract even to the thought of penetration. So many of you who experience vaginismus, who might have experienced vaginismus at that level, or if it's really severe, will find themselves tightening up even with the very thought of penetration, even though it hasn't started or hasn't been attempted at that time. And that is what is called the cycle of pain. So basically, the reason why I'm explaining all this is because I want you guys to understand that when we talk about treatment of vaginismus, when we try to incorporate different techniques, we really want to make sure that we are looking at both the aspects of this condition. We are not, I mean, a lot of times, people just get information from the internet. They get information from other people who have tried um, certain interventions, like for example even dilators. There are so many dilators on the market, and those companies that sell the dilators, they advertise it, and people with vaginismus might think that, oh, I should try the dilators, and they just start using them. But I want you guys to understand and notice that just taking a dilator and using it, even following the instructions without paying attention to the psychological component of vaginismus, will probably not get you any results. The reason being the whole um, the why part of vaginismus is a big deal in it. So it's like only addressing one thing without addressing the second component of it. So no matter how much we dilate that area, but if we are not taking care of the cause of what is the cause of it, we are not really addressing the issue completely. Okay, so that's what that was my main purpose of sharing the anatomy and the pathophysiology of vaginismus. Going forward in my following posts, we'll talk about a lot of different things, and we'll build on this information so that it's very helpful to you. Now, um, I think I've covered pretty much what I intended to cover in today's session, anatomy and pathophysiology of vaginismus. But my attempt with every video or post will be to give you something like a strong takeaway from it. So I just don't want to feed you information that you might find easily everywhere if you just Google it, but I want to give you something meaningful to practice or do at home. And that will be my attempt anyways with every post or video that I make or share with you guys. So today's takeaway, this is what I would like you guys to try. If this was a live session, I would have asked you a question and you would have probably answered or responded in the comments. We cannot do that because this is a recorded video, but you guys can still respond in the comment section after watching the video about you can answer this question over there. It will just give me more information about the population that I treat. How many of my question is, how many of you have actually seen your own vagina? Okay, I know, I mean, you might think, what is she asking us? But trust me, it's not uncommon for women to not have seen, understood, and explored that part of the body. It's something to do with the society, the way we're raised. There's such a taboo around it. We don't even use the medical terms. We try to use code words to talk about this body part. But especially if you or someone close to you is suffering from this condition, I would recommend that you make an attempt to actually look at your own vagina. And I'm going to share pictures right here in this video about how you can do it. It's very simple. If you have like a big wall mirror, you can sit in front of the mirror with your knees spread out, and you can see yourself in that mirror. If you don't have a wall mirror, you can just use a handheld mirror right in front of you in the same position, and you can look at yourself like that, as you can see in the pictures above. Another way of doing it is just, I mean, if you really don't have a handheld mirror also, these days selfie sticks are very common. So you can just use your cell phone even with a selfie stick and put it right in that area and see yourself in the in your phone. and just try to correlate what I explained earlier about the anatomy, and see if you can match those body parts that I mentioned in the anatomy section with your own vagina. Um, I always feel when we talk about knee pain or when we talk about spasm in our neck, what do? We always try to look at it, and we see, is there any swelling, or we try to touch it and see how painful is it, or we try to touch it and see, are there any trigger points that that are a bit more painful than the others. So this is information that we try to gather from any other body part that might be injured or in pain, right? So I think when it comes to vaginismus, it's important that you look at and explore your own vaginal area, and try to understand your own unique situation. Where does it hurt? How is your, you can even see, you can try to just feel it and try to see um, how much is the tension in those muscles around there. Okay, this is something that I would really like you guys to try. And so with that, I would like to end my session today. Again, my name is Aparna Kamulkar. I am a pelvic floor physical therapist in Central New Jersey. The name of my practice is Prana Physical Therapy and Wellness. I'm just going to put my Instagram hashtag. If you guys can be kind enough and just leave me a comment on my Facebook page, or um, like my Facebook page, I would appreciate that. You know, it's a pleasure meeting you guys like this. Please, if you have any more questions, feel free to post them right underneath my post of this video, and I'll try my best to answer all those questions for you guys. And the next session that I plan to do is on breathing. So when I get a chance, I'll be putting for I'll be publishing a video in this group about breathing. And until then, guys, I hope this information was helpful to you. Wishing you guys all the best. Okay.